fire trucks just passing.
All right, we should be live. So, good morning, everyone. 1 Million Cups is a weekly event started by the Kauffman Foundation and is currently held in, well, I want to say more than 130 communities, but with the new website rollout, I think that number is actually a little bit less. So apparently they did some cleanup, which is good to know. Anyway, these communities across the nation meet with the goal of caffeinating entrepreneurs nationwide every Wednesday. And every Wednesday, those communities meet to give each other support, feedback, encouragement over a cup of coffee. Our community meets here at Rome in the town at Trilith every Wednesday morning from 9 to 10, and 1 or 2 early stage startups will present their companies to a diverse audience of their peers, mentors, educators, and advisors. Before we get things started though, I just want to acknowledge and thank our community sponsors. Rome for providing this beautiful space, Jason Hunter Design for volunteering their time and resources to organize and promote the event, Edwin Jarvis for the high quality flyers that we promote, distribute around town, and of course, Counterculture for the coffee, which as a reminder, if you are here in person, just tell them front desk that you're here for 1 Million Cups and they will in exchange give you a free cup of coffee. Our first slot this morning with 6 minutes to present is Elizabeth with HealthSprings Direct, a locally owned and operated primary care practice utilizing a direct primary care model that operates outside of the traditional insurance system with the goal of making quality care more accessible to all. At the end of her presentation, she will be asked, what can we as a community do for you? Which will start the Q&A portion of the program. After 20 minutes of Q&A, we'll shift over to our second slot, provided they show up. They will be Sheila with Cala Rossi Float Spa and Sauna, a new local place to relax in their sensory deprivation tanks and infrared sauna tanks. So give me just a moment to deal with technology, and then I will switch over to Elizabeth. I will tell you in just a moment. Let me get plugged in here. Hey, if you want to grab a chair from out there, you're welcome to. You're good where you are as long as you don't go out the window. Just give me 1 more second. There's one more toggle I need to do. Switch video source to camera. All right. You are up. Let me just get my presentation out of here. Do I stop? Maybe we'll start at the beginning.
Thank you.
Okay.
Go to the next. So I'm Elizabeth Jaggers. I'm a local primary care doctor, and I'm here to talk about my practice, HealthSprings Direct, and also more importantly to tell you about what direct primary care is, model. So just briefly, these are the lovely people I work with. Dr. Springston is also here in the audience to help you with some of the questions today. She is the owner, founder, other physician in our practice, and we also have an admin. So next slide. The most important thing I want you to know as a patient, as an employer, as a member of the community, if you work in healthcare, as a healthcare worker, is that you have choices. I was a healthcare worker, first as an ER nurse, and then later as a physician, 20 years. Didn't realize that I had an option outside the traditional fee-for-service system. Next. So what is direct primary care, this model? What does that mean? Very simply put, it's a doctor and it's a patient sitting, looking at each other in the room, the doctor providing care. It is not all of these other things in between. So you can see under the fee-for-service model, there are all of these obstructions between the physician and the patient. There's insurance policies. There is so much red tape and paperwork. Believe me, what you see as a patient isn't even like, the tip of the iceberg when it comes to electronic medical record systems. There's staff members. And I think that these things were started as tools. These were tools that were supposed to help patients. These were tools that were supposed to help doctors. They help nobody. They are obstructions. And so our goal is to either eliminate these things or to revert back and figure out how to use them as tools to actually help the patient and how to actually help us. I had a patient, I used to work for Piedmont, but this is true in Emory, Wellstar, any of the big healthcare corporations. I had a patient that came to see me and was like, every time you remodel your office, the desk between the waiting rooms of patients and the back office gets bigger because you guys think I'm doing the wrong thing. And I thought it was such a good illusion for what is actually happening. Next slide, please. So what we do logistically, like I said, is we try and eliminate some of those barriers. The way we make that work is we keep our overhead low. We do not accept insurance. This is a membership-based plan, but we offer an incredible value along with it. So there is a cost, but more importantly, there's a value. Because we have low patient panels and low overhead, we're able to spend an hour with our patients each visit. We have same day or next day visits available, and we're accessible. We have a patient portal. We have that big EMR that the other systems have. We just actually answer our messages. If another staff member doesn't do it, we do it. We usually do it within a very reasonable time frame. We're also available by text, phone, and there's continuity. You're not going to come to the office every now and then. If I'm out of town or Dr. Springenson is out of town, you may see the other one. But that's pretty rare. There's only two of us. There's no one else to see if you come to the office. So there's a lot of continuity, and it's personalized care. We utilize evidence-based care and algorithms, just like the traditional system does. But we can mold that to who you are because we remember your family history. We only have 300 patients, and then it gives us room for innovation too. We have time to figure out things like communicator ultrasound and, staying up to date on what's actually happening in medical research, supplements and other functional medicine aspects. And then there's our cost. Another big value for us is cost transparency. That is sorely lacking in the traditional care system, and we like to be upfront with people about what the cost is. So I included it on there. Okay, next slide. Another big thing that I think is important for the community to know, and this is an area where you guys can help us also, is that this is important for employers to know. So we even started a employer plan as well. It's for small business owners. It is not for large corporations. They have legal requirements where they have to offer some kind of insurance, and we are not an insurance plan. I'm not doing this. We are doing primary care. But, we are something that could be offered if you're a small employer, you've got 30 or less employees, and you want to offer something. One, because it draws in employees. One of the statistics I have here is about, this is the number one thing that employees are looking for. So in this market where there's a huge shortage of workers, you're needing to pull somebody in. Offering benefits is huge. And that doesn't have to look like a huge Cigna plan or your traditional insurance plan. Those things are wildly expensive. But if you could offer something that we offer, it's definitely a buy-in, and it's going to, the moral thing is it's going to make your employers healthier and probably happier, but that's also going to translate to increase in productivity. Because when you have employees that are not well, they're not coming to work, but also they are coming to work and they're getting other people sick, and they're not working as hard. They're making mistakes because they can't, because they don't feel. So I think it's a good thing to know. It's kind of a way to sort of think outside of this. Next slide. And because this presentation is not just about our practice, although I am, this is about direct primary care as a movement, as a way to take your healthcare back. So I think it's helpful to know that there are direct primary care practices in all 50 states. There are two others. There's actually two Dr. Harris's in every city that also do direct primary care. They are not our enemy. They are not our competition. They are our friends. We all support each other. Lots of direct primary care options out there, and more resources for information if it's something that you are interested in other areas. the 6-minute mark. And that's primarily what we do.
You are actually right on 6 minutes, so congratulations.
I thought it was like,
No, yeah, 6 minutes. That was great. So I am supposed to ask you what we as your community can do for you. What would you
Sure.
like from us today?
Tell people to success. Tell people it's out there. I think that people are so, myself included, as somebody who is in the system, we are so entrenched with the idea of I have to get insurance from my employer. I have to use that insurance. I can only go to places that take that insurance. This insurance is going to help me, when in fact, most of this is. So yeah, understanding that there are other options out there.
So I told you before most people showed up in the room that I am a DPC patient. Dr. Harris, Dr. Erin with 2N Harris, is my direct primary care physician, and I have absolutely loved going to her. In fact, one of our other employees at J Center Design is there right now giving blood because she's getting onboarded there. She decided she liked what I had to say about it, so she went and tried it out, and she's on board now. And we just, as a family, well, that's something I want to touch on. So we love it, right? When I say we, it's right now, it's just me and my wife. Pediatrics doesn't seem to be something that plays in this space. So we have a whole separate, well, there's no DPC as far as I know for pediatrics. So, that's kind of one thing I was going to ask is why is that?
Yeah, so there are DPCs that do pediatrics nationally. I don't know of any, but there are a lot of practices where I'm an internal medicine physician, Dr. Springs is internal medicine, we only see 14 and up, but there are a lot of practices where it's family medicine. So we were just at a conference this summer, we met a lot of physicians nationally who see, baby to death all the way through. Wow. So that is a thing. I don't know that it's a thing anywhere at this point. Yeah. And there are specialists also that are hopefully more and more going to be getting into this. We met an oncologist this summer,
wow.
An endocrinologist. So there are other specialties that are getting into it. Right now, they're reimbursed better than primary care. So there's not as much incentive for physicians to go out and make this happen. And that's just honestly probably why it's not happened yet. I do think that will change.
I'm going to circle back with other questions, but I really want to hear what anybody else has to say, because I think for most, can I ask how many people in the room have ever even heard of direct primary care, this whole model? Anybody? You have? So that's, it's really interesting.
I'm interested because I just retired from Delta and my wife and I became a state agency with college. Based on my brother, called this lady named Heavenly and talked to her. She's a concierge for neck community doctors and stuff. She finds the cheapest route for us. She used to have in Delta's Blue Cross Blue Shield, all this kind of stuff to take care of everything. So now what you're saying sounds interesting. Took a couple of pictures to connect with you guys to find out how it would benefit us. $90 a month, $90, is that what it is? $90 a month membership. So I don't know. She's the CFO of the so I'm gonna throw the money in that's her direction.
We have that happening. There's one member of the couple. Yeah, we do meet and greets also with people to kind of explain the practice because it is a little bit new. Just because people want to sit down in front of the doctor, they're finding out sitting.
Question. Two questions. So is there anything that's not associated with the monthly fee? And is this model like I guess it's because it's not extremely popular, is it because that you guys are possibly leaving money on the table by going the traditional one? Right? Like,
yeah.
Sort of
that's a good question.
Yeah.
Sorry, now I'm going to what was your first
question? Things services
oh,
are
not
not associated with
yeah. So the monthly membership includes obviously any of the appointments, no co-pays or anything like that. And most of what we do in the office. So we do an EKG, we have some point of care testing, statistical stress, urine test, any of the exams, things like that are offered. We do currently send people out to have blood work done. That's something that's going to be changing a little bit in our model in the next couple of months. but we can get wholesale pricing. Because we have a lot of patients, we have people with fabulous insurance, literal billionaires. And then we have people with no insurance, people with health share plans. So we have a really diverse panel. So we are used to finding wholesale pricing on things like our labs and medications and things like that. So there are some other, just how we can help them save money sometimes. As far as us leaving money on the table, I got paid way more. I did. I hated it. I felt like I offered bad care to patients. You know, it wasn't worth it. Some things aren't worth the money. But yeah, no, I absolutely think that there is some money being left on the table. I don't think it's going to stay like that. The healthcare system, it's not sustainable. It won't be this way in 2 years because it can't be. There's no way. And so I do think that this is a movement that we're going to see more and more of. And I think a lot of doctors, I didn't know that this was an option. I knew about concierge medicine. But concierge medicine for me was for rich people. I didn't want to only take care of rich people, you know? I also didn't want to make myself available 24/7 to the point where I felt like I'd have to leave a movie theater to answer a phone call, which is not how this works. When I go to bed at 24 o'clock, if somebody calls me and it wakes me up, then I'll answer for business. And, you know, that's pretty rare that there's an emergency for the emergency room, you know? So we're available, but it's not concierge medicine. Concierge medicine also usually takes insurance and charges you extra on top of that. And their goal is to provide concierge care, not to provide a good best value per se.
Absolutely.
Yeah, I mean, I can attest to the wholesale prices. I mean, what blood work would normally cost $400, $7. Like, I mean, I'm telling you, I paid $7 for blood work through Dr. Harris's
If
office.
we do our full panel for the average adult 40-year-old male, we get it a physical, it's around $40 or so. You know, I had a patient the other day who we had to check testosterone and a few other levels. His insurance company is charging him $750. I'm fighting with right now. I looked up how our prices would be if we had charged it through us. It's like $100.
Yeah.
And this is all the time, you know, so yeah.
So what don't you cover? Piggyback kind of off of this
Sure.
question, what don't you all provide?
So any kind of specialty care, we cover more specialty care than your average primary care doctor, because when you go see your PCP for a traditional practice, they've got 8-9 minutes with you. They can't cover as many things as they technically is within their scope to do. So we end up doing a lot more specialty care. But like if I send you to a specialist for a colonoscopy, or you know, you need to go see a neurologist or something like that, that's not covered. That goes through whoever you go to see. Everything else that we do in the office, I think I've covered.
So if you're not a medical professional, explain what the difference between specialty care, because it seems
Sure.
like everything is specialty
I
care.
know. That's because most primary care sends you out for everything now, right? Whereas like we can do some skin biopsies in the office. We can do, you know, I end up treating things in the office that I would have referred previously. So primary care, anything you would have seen your general doctor for, we can certainly do, and then we can do a lot else. But specialist is like a cardiologist, an endocrinologist. Obviously, I'm not doing surgery in the office, so like you know, anything that you would have had to go in for a procedure. We do a lot of GYN care too, so we have a lot of our female patients. Some of them will still, we don't do full OB, so if I'm having an AMA, send them to the the specialist.
But a
we
pap
do-
smear is something that is included in the membership. So my wife doesn't have to go to her OB to get that done. She can
Yeah.
just do it as part of our
100%.
membership.
We can do some like of the very early fertility. We can do a little bit. We do management contraceptive, things like that. So we do lots of GYN, lots of mental health care.
So I think my biggest question at the time was, what if you do need to be referred out to go and do these things, right? So you kind of mentioned earlier that you have some patients that come in that have incredible insurance and others who don't, right? So when I was exploring this, it was because I was very unhappy with the typical insurance that I was paying through the roof for and never felt like I was getting anything for what I was paying, right? So you mentioned typical insurance and you mentioned health share.
Mhm.
So I was turned on to Liberty Health Share, and we're still with them after all these years. They've paid for 2 and will be 3 pregnancies. They've covered just about everything that I can't get done in the office. So that's one option. So we do not have traditional insurance. We're part of this health share. As a member of a health share, you are considered self-pay. So to their point, when you go into any specialist and you tell them that you're self-pay, you get rates that are ridiculously cheap. And then you can submit that to the health share and get paid back as long as you've made your deductible minimum and, you know, other situations that you're already used to. But with the health share, for instance, I think we pay Liberty $749 for a family of 4
A year?
a month. It's a month, but I don't even know how that stacks up to regular insurance these days. I'm assuming that it's at least half, but I don't know for sure. Our deductible for the entire family for the year, though, is like $3,000, which, like I mentioned, we have a separate pediatric doctor. It's probably $3,000 right there. You know, I mean, it's easy to get to the 3, and then it's the rest of it is reimbursed from there. I've had nothing but great experiences, and I am highly recommend people look into this.
And that's always say you're self-pay. You would think if you don't have insurance to specialists, they would automatically assume that you're self-pay. But I've had patients where they don't do that. And like, I don't know what it is in every, and Piedmont is 60% off. That's huge.
Huge.
You know? So
I see the bills negotiated after, like
yeah.
when I don't remember the exact numbers, but when we had our daughter, no, I think it was when I was in the hospital for COVID a little over a year ago. I was there for 5 days. The bill was like $30,000. I submitted it to Liberty. Liberty calls the hospital, negotiates the self-pay rates. What Liberty ended up paying them was $8,000, maybe somewhere in that ballpark. It was insane, like laughable. And I'm so grateful that I didn't have to pay any of that because I had met my deductible. But even if I hadn't, and I had to spend $3,000 instead of that full price, it's amazing.
That illustrates what a sham
Yeah.
insurance is
Yeah.
in general and how most of that money is going to use.
Yeah.
I have a question. In your opinion, what is the best client, perfect client for this type? For this type of
Somebody who's
business?
really healthy. Never takes seriously.
That is not-
You know, I really think it can be good for everyone, honestly.
Funny answer.
I don't know if that was for me or for everyone. Yeah, you know, where I found it really helpful is people who have either multiple specialists and things are getting lost in translation, or somebody who has a set of symptoms that doesn't fit into the typical box of, oh, you have this disorder or this disorder. And so they're getting frustrated because the time constraints, if you show up to the doctor's office and you don't have symptoms that pan out, a lot of times, you know, the implication is those symptoms aren't that big of a deal. Maybe they're not real, or you should see this specialist, and this specialist. Not even give you an answer. So I found that my patients that have had that experience to be the most satisfied when they come and see us, and we can kind of help put things together and think outside the box a little bit. But honestly, I mean, we have a very good attrition rate with staff most of the time. So I think that it can be very valuable to most.
Thank you. Would it make, is there any situation where it will make sense to use the traditional health plan as opposed to going down?
I mean, we encourage people to still have insurance if it's something that's important. It's not for everybody in this country, right? Because this thing is your employment, which is what you're looking for.
Well, why even, I guess why?
Why? So that if you're in a car accident and it's covered, you know, so you diagnosed with cancer, something like that, things that, you know, I can help only to a certain extent as far as, you know, yes, you self-pay, here's a wholesale price, things like that. But it's still a good idea to have some kind of insurance, rather that's a health share plan, which technically is insurance, but, you know, or traditional insurance really depends on what your employment situation is, what your income is like, you know. We also have patients on Medicaid and Medicare. So to have something that's available to be your safety net absolutely makes sense to still have it.
It's like catastrophic coverage. And you have the choice to decrease your yearly premiums. Correct. With direct repair and potentially save money.
Yeah, like these gold premium plans are garbage. It's not a real thing. It's not offering you, we do not have in this country, the only assurance that your bills will be paid 100% if you're in a terrible accident is if you're a billionaire, right? Like that's what that is. And so sometimes these like higher tier plans, if you go to a lower tier plan, still have that backup coverage and save yourself a lot of money by having.
As a, in my case, my philosophy has always been a highly upgraded veterans, pushing way out there, just deal with this. But I've never had an opportunity to deal with the rest. It's always just kind of use the same formula. So this to me would be a great avenue to kind of deal with the rest, because I bang myself for the things that I do, and then I got to do my insurance.
Yeah.
So it's feel like that catch all, 90% of the way to do.
Well, we focus on prevention and screening as well. So the upkeep and making sure that we're not finding.
That's actually the last thing I was going to say, is that I look at this as being like, you asked who the perfect patient would be, and you kind of jokingly said somebody healthy.
There's no problems here.
But honestly, I look at DPC as being more proactive healthcare than reactive healthcare. So not just going to the doctor because you fell off your bike and have a scrape and want them to look at it, right? Like somebody who's going to really, I mean, first thing she mentioned is like, we spend an hour with our patients. What doctor spends an hour with you? But when you sit there and you talk for an hour, you uncover things that you didn't even know you needed to talk about that are directly related to whatever thing you didn't even think was a thing. And the next thing you know, you're getting treatment for something that could prevent the next 5 things from happening. And that has literally happened with me. And that's one of the things that I love about it the most. So, you know, I think everybody 14 and up could be a patient of theirs is the right type of patient, because no other doctor will give you the kind of attention that a direct primary care doctor will give you.
Agreed. You should come to my-
As a matter of fact,
Like
that's what we do.
there's
Just kidding. I mean, it is, but. Well, I really appreciate that you guys came today. I think it's a testament to the DPC community that my own DPC doctor recommended you to be a part of this program, to like let people know that you exist, right? And I understand that you guys are going to be moving into the building that my DPC is opening up. So there will literally be 2 DPC doctors on opposite sides of the hall on the same floor of the same building. That's how they support each other in this community. And I know, again, like if there's something that you don't feel comfortable doing, you're quick to refer out to somebody who will also share the same level of care. I just think that speaks volumes. So thank you guys for coming. I'm not by any means trying to cut you short, because from what I can see, the second presenter is still not here. So we will just kind of open the floor to like a town hall type situation. Feel free to continue talking amongst each other. If anybody has anything that they would like, does anybody have anything that they would like to stand at the front of the room and share with the group to get some feedback? Because if not, we can just use this as a networking the next 20 minutes or so. Great. Well, in that case, I will end the Facebook piece of this and say goodbye to Salima. And actually, Salima, you can stay if you want. I think I can just stop the live stream. Well, we'll see everybody here next Wednesday from 9 to 10.